everyone. This is Dr. Anderson. I'm the Executive Director of Tova Community Health. And I have a practice and a program where I take care of people with chronic complex medical conditions like sickle cell anemia. And I have a great host today. As you know, we're launching Tova Tuesdays, where we try to answer all of your health questions, where we want you to get on a better pathway to a healthier lifestyle. I thought I'd start off with talking with a publicist who has done such fantastic work in the Philadelphia, New Jersey, Maryland area, Portia Hargrove, who is the CEO of PR Purpose Agency. Welcome, Portia. How are you today?
I'm fine. So I'm actually in Delaware now. But you have definitely touched my footprint. So yes, New York all the way through, but right now I'm primarily focused on Delaware. So I'm doing great. Thank you so much.
Good. So tell us about what you do, what is a publicist, and how you got started.
So I am, like Dr. Anderson shared, I'm the CEO of Purpose PR Agency. And a publicist is a person who brings, or organization, an agency or a firm, they bring attention to your brand, your who you are, what your business is. So Dr. Nina is a small business, but she focuses on sickle cell anemia, preventative health, of course, holistic health. Now she's introducing music therapy. And what we needed to do was take her brand and let it stand out from people who have similar practices. Allow her to be in front of the media, which is, any type of interviews through radio, editorial, or any type of face-to-face contact with her target audience. So I can kind of say the best way to describe a publicist is your hype person. So I'm the one that's constantly talking about the brand. Instead of her talking about the brand or talking about who she is or what her business does, it's always important to have someone else validate who you are or what your services are.
Yes, and I also want to say that one of the great things that you have done for Tova is you help tell my story. As you know, my background is in nursing. I have a doctorate from Thomas Jefferson University. My mother was a nurse. My grandmother is a Black Seminole Indian, which I learned a lot about traditional medicines and allopathic medicines as well. So tell the audience how you try to tell Dr. Nina's story.
So that's the most simplistic way of saying what we do for public relations. And so we show what our clients do that are good. We make it great. We tell what they do that are okay. We make it good. So what we were able to do for Dr. Nina is, even though she has traction and she's known in her circle of, from Wilmington, Dover, and Delaware, it's important for her to get her story out to people who are in, I would say, the footprint from New York all the way down to Maryland. So what we were able to do was we wanted to jumpstart her outside of the regular things. We wanted to put her in front of an audience who personally understood preventative holistic medicine. And so the first thing that we really launched is having her speak at a We Love You Foundation event that was held in Wilmington, Delaware. And it put her as one of the keynote speakers to address her community, because they knew who she was and because she was tied into not only just providing, preventative and, primary care information to her community. It also allowed her to talk to an audience that weren't familiar with her. So after speaking, the team from We Love You Foundation was very intrigued by her information, how relatable she was. And so she was offered to go overseas. So it now placed Dr. Nina Anderson, in this position where she's now international. And she was able to share everything from an audience that was not familiar with sickle cell anemia. She was able to put that new bit of information over to people who weren't familiar with this disease that primarily affected the African American community, as well as because she's a classically trained musician, violinist, then she was able to merge her knowledge and talents of being a classically trained violinist over to a community that loved classical music. And her being in South Korea, she was also able to show what she does with music therapy.
Yes, and I want to say that that was quite a phenomenal experience that I had going over and representing the United States of America, and actually having the chance and the opportunity to meet health secretaries from all countries, such as Chile, Iraq, Bangladesh, I mean, you name it. People that are really passionate about improving the health of their communities, the challenges that they have and how they've overcome that, and to be able to share on a national platform about sickle cell and the importance of blood donations for the African American community, it really intrigued them. And to my surprise, they were very, very receptive, very, very intrigued about what we do here in Delaware, and was like, well, where's Delaware? So it was such a great experience. I'm glad I went. I'm glad I had that experience to be able to go and share with the world about sickle cell anemia, and especially in the Asian community as well.
Yeah, and you were even able to bring them to Delaware to do a big blood drive. You guys did a collaborative effort, which is so phenomenal. It was yourself, Blood Bank of Delaware, correct? And the YMCA is where it was held in Bear. And so that's a chance to broaden your brand, because now she's not just known as sickle cell. She's known as other things, the knowledge that she has. And rebranding is very important. You have to teach people how to treat you and how to see your level of expertise and knowledge.
Yeah, you're right. You're right. So tell the audience about some of the other things that you do at PR Purpose Agencies, some of the challenges of being a small business owner. I know I can share a lot with the audience about that as well.
Well, I can say for small businesses, you have to always be relevant. So I'm kind of stuck in the position of always telling everyone else's story, but I have to tell my story as well. And for me, as a person who's doing public relations, social media marketing, special events, strategic planning, consultation, I can go on and on for the things that we do. It's important that we always kind of stay in front of ideas, especially the time that we're in right now. Some people may panic of how can they keep their business relevant. But as Dr. Nina and I have had strategic planning conversations about things that are the right now, and that would be like, of course, this. We're doing Tova Tuesdays where we can talk virtually, which she's already been doing communicating with her patients. So just taking that same concept and bringing it to a live audience, or pre-recorded conversation to a live audience. And for me, it's always staying above and in front of the curve. Like I said, rebranding. Even myself, I'm rebranding. My name was for a long time Portia Hargrove, but I'm rebranding to Portia Green. So now I have to teach people that I'm the same person. I'm just
rebranding. Anywhere.
Just rebranding. And again, I have to, not just because we're on this virtual conversation, but I have to commend Dr. Nina Anderson, because I'm always pushing her where she don't want to go, but she's willing to take those steps because she knows how important it is. And that's the purpose of a publicist. We see a vision for you, and the client has to trust us. And as a small business for myself, I have to let my clients know the importance of trusting me, trust the process. And for me, I just have to stay in everyone's space to know that I'm relevant.
And I would like to say too that you are a phenomenal life coach. You have just really
Thank
pushed
you.
me in areas that I, have been uncomfortable with. But, just that little nudge to get me to think outside of the box, I think has just been phenomenal. And to get the community to know me in a different way, it's been great.
Oh, I appreciate that. You've been phenomenal. Like her interviews that she's doing, her public speaking engagements, she may be nervous on the back end, but you can never tell when the camera light is on. She's awesome. And this is a prime example. So let me ask you questions. I know we're playing ping pong on this. No pun intended. She does ping pong.
Yes, I do play ping pong.
And that was another thing to think of. She was able to, her charm and her working relationships put the people from We Love You Foundation from South Korea and New York at such ease that they bonded enough to do mini ping pong tournaments. And whether it was up in, North Jersey or if it was in Delaware, that constant interaction is very important for all clients to know that you have to be consistent, authentic, and you have to be open to your client and your relationships. And so she's done a great job. Who brings someone for ping pong but Dr. Nina?
The West Center City Community Center.
Right. Right in the middle of Wilmington, right? So let me ask you, so we touched on it, and you said how it was a great experience for you to go over to South Korea. Knowing that you've had the blessing of being in and out of different communities and knowing different the habits of different practices, what was the vast difference of you seeing how the different people at this conference worked in medicine versus how we work in the United States?
In Korea?
Yes.
I would say that in the United States, we definitely have more resources than they do when it comes to providing access to care and specialty care to our communities and our populations. I would say what I learned the most from it is that there's so much need and so much need for good, comprehensive, coordinated care for people that have chronic conditions, and how you mobilize your country or your community to have all people have access to care, and how they do that on a very a small scale to a very large scale. And I guess the other is just being able to learn from other countries. I had an opportunity to meet with a organizer that has an orphanage in Iraq, and come to find out that there is a large sickle cell population in Iraq that needs care. And so one of the things that we talked about is, how can I bring resources to Iraq to help these communities, knowing that sometimes we do have some of the same struggles and the need for us to work together and not, just stay in our silos.
And that's very valid. I mean, because we do stay in our silos even here.
Yeah.
Even here.
Yeah.
So I'm gonna touch on something, because I think we talked, or I made a quote post. Dr. Nina gave like a quick post of tips of building your immune system up, keeping yourself healthy during this crisis that we're in. We're all very nervous and scared. She talked about zinc and vitamin C. What are your tips that you can give at this time of panic, I should say, to the people that are watching this podcast? Well,
as you know, one of the services that I definitely impress upon is preventative hygiene. I have a quarterly newsletter that I put out called Tova Cares, and I talked a lot about that in the United States. We're going to have to change the way in which we even greet people, because shaking hands actually transmit germs 10 times more than if you do a fist bump like this or an arm bump. Other things is just being more mindful of spacing. The coronavirus is transmitted by viral droplets through the air. So just staying 6 feet away from someone. As we practice social distancing now, this is a time that I use to really disinfect my house, which I never even done in the past. So making sure I had disinfectant with bleach and a little bit of water and astringent. So just being mindful of things that we do have in our control is really important. Getting restful sleep is important. And then, you said being mindful of things that we can do to boost our immune system, like taking vitamin C and zinc, just vitamins, echinacea tea, green tea, things like that just helps us just to be a little bit stronger in our immune system so that we can fight off some of these germs that we may be in contact with.
Yeah, I'm a vegetarian, vegan, but now I'm actually trying to be more disciplined, to be more raw. Because I know for me, I know my blood type, I'm A positive, and some people just don't know their blood type, but I do well being more plant-based vegan. But what I was going towards is that the mucus, it kind of like, it's almost, I don't want to say it disappears, but it's very little when I'm straight plant-based or straight raw vegan. Raw vegan is the key for me. Do you agree that maybe at this time, if possible, that people should probably think about being more plant-based instead of leaning hard on these carbs? I know we're in a section of a part of our life where we're just trying to eat and survive, but if it's possible.
Yeah, I actually for about 3 years had a garden where I grew cucumbers, tomatoes, and strawberries. What I've found is that, when you eat from the land and the soil, you feel better because fruits and vegetables and green leafy vegetables have a lot of antioxidants, vitamins, nutrients, minerals that we need. So to lay low on the carbs, but still making sure you get more of the colorful vegetables and fruits is very important. And I found that when I did have a garden, the food tasted so much better. Like a tomato, I could just put a little tiny bit of salt and pepper and basil on it, and I could just eat it raw, and it just had so much flavor. So I think that this is a time where we're really going to have to think about these type of things to really help our overall health and wellness. So it's a lifestyle change.
You made me want a tomato. I'm like,
yeah, I'm thinking like I need to get back out there in my garden. At the minimum, I'm going to have an herb garden.
Yeah. I think now's the time. I think everything now is taking us back to the way of how we're supposed to live instead of in this rush 5-minute world that I've gotten used to. So now staying home with your family, cooking dinner, the garden is an excellent thing. I think I might challenge you. Maybe I should start a garden with you.
It's a lot of work, but it's so rewarding. And I actually, lost a couple pounds on the way. So it was very beneficial.
Did you have any questions as far as like how, or telling people how you and I have been working together, trying to reposition Tova or Dr. Nina?
Well, I think it's just, as you said, important for people to know who I am. Some people don't know that I play the violin, that I'm really
great at it
in music therapy, and that I sort of bring all of these tools to try to provide better care for my patients and think outside the box about health and wellness, the things that we don't think about sleep, or what's your sleep hygiene like, or are you going to the park and exercising, or in my newsletter I'll talk about the importance of having a pet for those who suffer from depression. So I think that, the model of my care is a lot different than other providers, but I think this is at the time where people are really looking for healthcare providers to provide a holistic approach to their care.
If there are some people who were trying to reach out to you, I know she does the telecommunications. How do they reach out to you? Because that's awesome, especially like me dealing with, I have older parents, okay, and they're stuck in their ways, but now like you can't go to your doctor, like you have to call them, or you have to, like this. So how do they do that, Nina? Because I don't even know.
Well, I've been very fortunate to work with a great medical director named Dr. James Gill, who was also also named Delaware Family Physician of the Year. But one thing that we have been doing over the last 3 years is providing telemedicine visits. But, one thing I can say that sometimes from, these life circumstances, we've had to adjust very quickly, as you said, a small business. And we actually changed our platform within 2 days, and we went to doing more virtual visits with our clients. And our virtual clinics or virtual visits actually went up about 4 times. So we're doing like about 25 to 30 a day.
Wow.
I'm sorry, when we would do that in about a month. But it also gave us the opportunity for my patients who have sickle cell anemia and who are immunocompromised, that coming into the healthcare, to our office or to the emergency room may predispose them to more harm. So staying at home and social distancing is the best thing that we can offer them. And to be able to connect with them in a different way, I think it's opened their eyes, to say, oh, wow, Dr. Nina is scheduling time with me virtually, and that it wasn't that hard to do. All you need is a cell phone or a computer with a camera on it, and we're still able to deliver care to you in a different way. So that being said, it's been challenging, but I think it's an opportunity to really reach more people in a different way. And our goal is just to flatten that coronavirus curve, and we want our clients to come out of this healthy and safe.
Yeah, there's some people who are going through this and have no insurance, and I don't know how they're able to get through it, but I know you offer holistic care. I know you shared about the vitamins, but are there any other things people can do except for, I know you have to self-quarantine, but what do you do? Like, some people are scared because they literally don't have health insurance.
Well, one of the blessing about my company is that we're able to provide services to the community regardless of their ability to pay. And we try to do that, on a sliding scale, what you're able to. We definitely don't want anyone going without any kind of care, especially in these times. But you can reach me, and you can reach us going to our website at www.tovacommunityhealth.org, or you can call our office at 302-429-5870. And my staff will be willing to take your information, see if we can get you connected with Tova, and we will do whatever we can to make sure you're on a path to a healthier life.
Awesome. We're both small business owners.
Yeah.
And we both know the importance of supporting each other's business. And I appreciate you wanting to speak to me today, through this time. And again, I'm looking through some of my notes. I personally love working with businesses, even though I've touched entertainers, worked with entertainers, worked with culinary. But someone such as Dr. Nina Anderson, the reason why my business is called Purpose PR Agency is because instead of me always consulting and feeding and filling my clients, I want my clients to teach me. And I've learned so much being with her. And she's been a complete blessing. And from my one testimony, outside of her televisits, when we were able to be in close proximity with one another, she literally went with me to emergency and she checked on me. And I've never had a bedside manner like that ever. And you should be commended for the things that your grandmom and your mom have taught you and instilled in you. And you don't have service like that. So now that we're getting back to how we used to be, I think this is a time to celebrate those people that have always been that way. And you have definitely always been a very caring physician. So I appreciate
Nurse
you.
Practitioner.
Nurse practitioner. I want to call her doctor. Say I'm PR Purpose, but we know what we're talking about.
Right. And I think and I thank you for that, but it's a passion of mine. And as I said, I've had nurses in my family for many years. My great-grandma was the first African-American nurse practitioner in the state of Delaware. So I would say in my family, we've been challenged to serve the community. So it's a blessing and an honor.
Mm-hmm. And as someone who's on the front line, like, we definitely keep you in prayer because it's not easy. I know you're nervous too.
Yes. It's very it's nerve-wracking for me because the protocols just constantly change, every day. And I am in contact with people that perhaps have the coronavirus or maybe asymptomatic carriers, and so we have to use universal precautions as best as we can to protect ourselves. But I admit every day I go to work and I'm just prayerful for all of you guys to keep me in prayer, because tomorrow is not promised to me as well.
Absolutely. So I enjoyed today. Did you have any other questions?
No, I don't. I want to just thank you for coming on Tova Tuesdays. We are going to link this to the Tova Health YouTube channel. It's going to be linked to the Facebook page. So I thank you all for having me here today, and Portia Hardgrove at Purpose PR Agency for all that she has done for Tova and all of her other clients. Can you tell the audience how they can reach you?
Yes, so you can reach me at www.purposepragency.com is my website. You can email at info@purposepragency. All of my social media platforms. Well, if you're on Twitter, it's Purpose PR Agency or Portia Green PR. On Facebook, it would just be Purpose PR Agency. But if you can't remember all of that, you can always get in contact with Dr. Nina, and she can definitely direct you over to connect with me.
Okay. Well, I want to thank you all for joining me today, and we'll see you back again for Tova Tuesdays. Take care. And be well.
Be well.
Bye.